Well, the governor of Montana and I are proposing a two-state pilot program, Montana-North Dakota pilot program, that would be adopted by the Secretary of Health and Human Services to allow the reimportation of lower-priced prescription drugs from Canada to consumers in Montana and North Dakota. We would propose that licensed pharmacists and licensed wholesalers in our states be able to access the identical prescription drug, same pill, put in the same bottle, made by the same company, except sold for a fraction of the price in Canada. We would propose that be allowed to be imported into our states and give our citizens the savings that would come from it. The savings could be hundreds of millions of dollars a year just in Montana and North Dakota alone. You know, the interesting thing here is there's no difference in the chain of custody of prescription drugs between Canada and the United States. The chain of custody is nearly identical. There are no safety issues, and the Secretary of Health and Human Services has the legal authority to do this type of pilot program. And Governor Schweitzer and I decided that we were going to seek to have North Dakota and Montana be the pilot program that would demonstrate how much is saved by bringing in the identical brand name prescription drugs and selling them at a fraction of the price through our pharmacists and through our wholesalers in North Dakota and Montana. It's just unfair to our constituents all over the country, but it's unfair especially to the northern border states that we pay the highest prices in the world for prescription drugs when 5 or 10 or 50 miles north of us you can buy Lipitor for a third of the price or tamoxifen for an 80% discount. It doesn't make any sense to me to have that continue. I believe that the American consumer ought to have the freedom to be able to have access to those lower priced prescription drugs wherever they are sold. And these are brand name drugs made in an FDA approved plant, FDA approved drugs sold all around the world. The difference is in the U.S., the American consumer pays the highest prices in the world. That's not fair, and that's what I'm trying to correct.